See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Voice and representation does matter. Everybody should be reaching out to the community. And I'm biased, but I believe that the faith leaders are really a good starting point because it only grows from there. When you look at some of the obstacles and the systemic challenges that we have, it's multi-pronged, it's multidimensional. And so your solution can't lie in a single source or a single source of individuals. But I think the faith leaders are a good starting point because they connect you to other people who are the people we serve in the community.
Welcome to See You Now. I'm Shauna Butler. Faith-based partnerships. There's been a long-standing relationship extending back decades, even centuries, between faith and clergy and health care. In our brightest moments of joy, gratitude, and exultation, and in the darkest times when we feel alone or frightened, in pain, uncertain, and in doubt, many of us call upon faith, beliefs, and rituals, our own and those of others. We do so for strength, for courage, for comfort, for meaning and direction, and increasingly, also for innovation. In this episode, we explore how looking through the diversity and inclusion lens is driving health innovation to improve access to care and address health disparities, and how partnerships with our faith leaders and congregations can build trust and break systemic barriers to access.
I am Tukea Talbert. I'm a registered nurse. I'm also a certified diversity professional, and I am the Chief Diversity Officer at UK Healthcare in Lexington, Kentucky. UK Healthcare is an academic medical center, and it's a land-grant institution. We serve all of the Commonwealth of Kentucky. We're a level 1 trauma center, also a level 4 neonatal intensive care unit. Soon, we will be well over 1,000-bed facility. Kentucky is a beautiful state. It has beautiful, beautiful hills and dales and farms. We are known for the Kentucky Derby. That's every year. UK basketball. And it's a great place to live.
Where are you today?
I am in Lexington.
You've had a busy day today. What's it included?
Today has been really fabulous. I started out with one of the mobile vaccination clinics that we've set up to reach some of the underserved populations here in the city of Lexington, and it's at Keeneland. We're going to give 500 doses today. And so it started at about 8 o'clock out there, and it's a little chilly, but once we moved our people through, it was really great. There were so many people that wanted to have their pictures taken by their spouses or family members that had accompanied them. One lady, she said, I want to send this to my grandchildren because in about 8 weeks I can hug them. And it was good. It was incredible, and she had joy all over her face. And, and I said, well, you take that picture. And I think that's a fabulous idea. But it was really great. Yeah,
it's really fun to see how this whole new genre instead of memes, the vaxies instead of selfies. We've got vaxies going out there.
I like it. Yes.
Yeah.
Yes.
And it's an interesting observation that you shared, that people were feeling joy. And we talk a lot about what vaccinations are going to do for us medically. But I don't think that we've talked very much about the emotional stress that we're carrying not being vaccinated. And so when people get their vaccinations, right, what a sense of relief they're getting.
Yes. A shot of hope. It is. And Shauna, is a very excellent point. And the beauty of this system, at least for these mobile stations that we've set up, that lady knows that she can come back in 21 days and she will come to the same site, same time, and get her booster.
So I want to pick up on a word that you just used there, mobile.
Mm-hmm.
This is a huge issue. Access to care, in its widest sense, includes a lot of different elements, and there are a lot of barriers. When you think about access to care, what are the ways that you think we need to be addressing access to care, and more importantly, innovating to expand our access to care?
So I love that question. First, as people who have been in the healthcare system, we have to start thinking of access to care and the care not just being within the four walls of the hospital or the place we commonly do our work. Because so many of the causes for those access issues happen far before the patient even reaches the doors of a hospital. So often we limit ourselves because of where we believe care has to happen. Part of the innovation and the reframing and changing the narrative around that is looking at where it should happen. And a lot of times that's going to where the people are, because they don't always have to come to us for the care that they need. And that expands the boundaries by which people can receive care so that it's not just limited to a structure and a place they have to come to. And when you think of some of those common causes, and we can call them political determinants of health, often referred to as social determinants of health, it's economic, it's neighborhood, it's education, food, all those usual suspects. But it's also the community and social connection and integration. And I think that that's something we often take for granted when we're thinking about healthcare, that we don't think of that integration for the people and the engagement and the empowerment of the people, and how liberating it is to, one, involve them in the solution, but also engage them and in a space that's comfortable for them.
I like that word that you use, comfortable, because that is so much of what we do in health and in healthcare. It's the alleviating of suffering. It is the building of comfort. And there's more than just the physical comfort. I mean, I think that's where our mind goes immediately to, is when someone has a physical pain, but there is also that emotional, that psychosocial, that spiritual type of pain. And you have this fabulous new role within your health system. I would love for you to share what it is, your enthusiasm about it, and your vision and action plan.
It's new to UK healthcare, long overdue, but new to UK healthcare. I'm wildly excited and enthusiastic about it. It's the Chief Diversity Officer for UK healthcare system. So one of the primary charges would be to oversee all diversity, equity, and inclusion efforts across the healthcare system. And this position establishes the foundation to hopefully perpetuate and strengthen the business case for diversity, equity, and inclusion, but also looks at how to develop those unique and very essential partnerships, not just within our hospital, but outside the boundaries of our hospital. And once again, looking at community engagement, visibility, and presence, and also with our campus community, because our overarching goal for the UK healthcare system is looking at a healthier Kentucky. Well, the only way to do that is looking at the partnerships we develop and the dismantling of obstacles for people in our community to access our care and our system.
There are two things I want to dive into here on this. When you talk about this role and this title, oftentimes it has a tendency to feel very externally facing, like here's what we want to do with our community, here's what we want to do with our patients. Sure. You also have this other really important internal role that helps to drive those external impacts, and that is thinking about your workforce. How are we training students to think about diversity and inclusion and equity? How are we hiring for that? How are we building psychological safety in the workplace? It's really easy to put that placard up to say, we're all about diversity and inclusion, and go reaching out and push this agenda on the community. But those things have to be reflected in your own organization. I'm thinking you're agreeing with me.
Yes.
So what are you doing from the standpoint of building an organizational culture And what is
Yes.
the business case for all of that?
So when you think of building an organizational culture, one of the very important things, so with the diversity, equity, and inclusion plan, the strategic plan, there are pillars, right? There are pillars of success and foundational pillars. So that, as you stated, is the workforce. One of the things that we've been focusing on, and it's been a snapshot, is workforce utilization, but it's a one time a year snapshot of where we are. And my thoughts are, at that point, that's far too late for people to do anything about where we are. So one of the things as we move forward in terms of that space, we want to be much more intentional about our applicant pools, about leadership succession planning and developmental opportunities, and how we're selecting people and what that looks like. We've not really looked at what our applicant pools look like. Our vision is that we look different, but our plan hasn't necessarily been aligned with our vision. And I've often said, Shauna, to individuals that a vision without a plan is simply an illusion. You know, we're not going to get there. So we've had much more intentionality around, okay, who are we including in our candidate pools? How are we advertising for positions? And what are we doing to look within our community footprint to look at how we can bring more people in? And they don't have to be nurses and doctors. We have several people that help take care of patients.
Yes, we need our physicians, we need our nurses, we
Sure.
need our pharmacists, all of those folks. You have an initiative where you've expanded like how we care about people and who those folks are, and very specifically reaching out to our faith-based communities, our faith leaders. First of all, how is that a meaningful way to innovate, to improve access? And then what does this program look like? And
Right.
how are people experiencing it?
When everything with the pandemic started, and of course, it put a magnifying glass on where we are and where we are in terms of health disparities and some of the barriers and obstacles that marginalized groups of people face. So really, when you started looking into that, you start peeling back the onion, you start thinking about trust, right? And so a lot of the studies out there done by the NAACP and different other African American research collaborative studies have indicated who is it that people trust. And oftentimes at the top of that list, and I will say nurses are up there as well. But the other part of that are the faith leaders. Oftentimes, and especially African Americans, they often have their resilience and source of strength on their spirituality and their spiritual journeys, and those individuals who lead the flock, so to speak, when it comes to their churches. And so using that as a platform and as a point of leverage, we've been very successful to partner with some local faith leaders to sit down and have very, very transparent discussions around what would a partnership look like with UK Healthcare, maybe 20-ish. But then we developed a subcommittee of that larger group to really just kind of sit down and roll up our sleeves and talk about what are some of the issues that people in the community are experiencing as it relates to their health. But then what are some ways that we could partner to help address some of those challenges? And we developed what is called a community health education series. The topics are driven by some of the challenges that stem around access, but also really early interventions such as screening. So we've kind of taken on some of the themes for the different months. For instance, we launched it in October of last year. So we focused on breast screening. We focused on how people might access different areas and supports and programs to get early screening for breast cancer, colon cancer, lung. Since we had everybody, we wanted to use that forum to look at men and women and some of the things that they were most vulnerable to and are very preventable if caught through screening. So we've been working with those individuals, and the really next exciting thing that we're doing, Shauna, is now that we have the COVID-19 vaccines, we're working with them to look at community communication and education, because just having the vaccine doesn't mean that everybody's going to be raising their hands to receive it. So people like, for instance, the faith leaders, seeing them and making public if they are okay with being vaccinated. Also sharing information from a collective voice of people who look like the people that you're trying to encourage to consider being vaccinated. So I think that you have to use all those things that bring people comfort and security, and that's people that they trust. So that could be people in the healthcare arena, nurses, that could be faith leaders, and that could be family members, but it also can be space that's comfortable for them. So we're working with that group to leverage and use as a megaphone to say, what is it that we can do to help share information? Because we want people to make informed decisions. And a lot of that stems around pastors being people that they can trust. And we're planning a town hall, and we will have site coordinators to be at these locations. We will still use virtual option because we still don't think it's safe for large groups of people to get together. And we're working with some people from the mayor's office to look at how we may even communicate that and launch a virtual town hall that will cover many vulnerable sections of the city simultaneously.
Going back to that word that you talked about, mobile, and finding people of trust and places of trust and meeting people where they are, that's required you to mobilize your resources and to go and be in different places. How do you start and open what can be a difficult conversation because of some very serious past transgressions where trust was betrayed? You have a lived experience as a Black woman to help identify, I hear you, I see you, I get it. For somebody who has to go into this conversation, how do you start it?
Well, you can't deny people's lived experiences. So you let that elephant out at the beginning. I mean, it's clear. You don't try to overlook that. But I think that there are some benefits of being a Black female and going to have those crucial conversations that you look for things that will give you some points of leverage. And one of those would be the fact that I'm looking for racial concordance and some other commonalities that we share. Everybody has a story to tell. So maybe you start out with that because you don't want to ignore what someone feels and the experiences that have shaped where they are in this moment. We have to acknowledge that and be comfortable listening intensely to that, and then working in partnership with individuals about, okay, so how do we rebuild that trust? And you have to be willing to be all in. And so when you're looking at how you meet people where they are, you have to be willing to accept those terms and not have limitations.
Recognizing, look, there are many places where we have fallen short, and the data shows it. I mean, when we look at health statistics, the disparities there is no getting around it. So when you say we're going to meet people where they are, you're going to be the one that has to do the furthest amount of change, travel. So when you're in their place and you are listening and following what their lead is, what's being asked and what are you needing to do? How are you innovating to say, absolutely, we're gonna make good on this?
Well, some of it is really even very basic. When we talk about some of the mass vaccination centers, most of them require people to have transportation. So because you build them doesn't mean people will come, and you will probably continue to see a disproportionate representation or lack thereof, because I always say the challenges that people have not gone away in terms of access to healthcare. So one of the things is that, okay, so how do we get people to those centers? And if we can't get people to those centers safely right now, then how do we get to the people? So people want to know, what are my options? And it has to be more than you having a mass vaccination center on the other end of town where I'm not, and I don't have transportation. So there are those things and factors to consider. People tell you what they need and what they want. And you know what? It makes a world of sense. And so when we've developed some of these units that we're placing in vulnerable sections of town to reach some of our most vulnerable individuals who have been disproportionately impacted, They come for their first and booster to the same location at the same time, and their card tells them the date. They get the date they should return when they get their first shot.
Shocking, the simple things that are the barriers. What we are experiencing and having disturbing reports is just how hard it is to get an appointment. That if you don't have access to the internet, if you don't have an email address set up, that you can't set up these appointments. People can't communicate and say, here's when your follow-up is. All right, how are you solving that?
Well, numbers, telephone numbers. Now, most people have a phone, more people than not. At least even if it's a cell phone, right? So you can call a number and you do not have to have an email and you do not have to have internet. So you do that by telephones, which allow, for instance, myself, if I have the site and you give me the information, we can on the phone talk through that, and I'm signing you up as we speak.
So just a lot of hand-holding support to walk people through the steps.
Yes.
Yeah. You mentioned your faith-based leaders visibly sharing social media campaigns, talking, maybe even preaching about their confidence and their decision to be vaccinated. We haven't been tapping into the most trusted group within a lot of faith communities where there is a connection between medical decisions and seeking spiritual counsel and people that we trust to guide us in existential matters, life, birth, how we think about end-of-life care, all of those things. What are you doing to engage the faith leaders to be health educators?
One of the things we're working out of the mayor's office here locally is there is an external entity that has agreed to do some advertising with communication and education about the COVID-19 vaccine, and very targeted selection, like where we will put posters and have infomercials and videos. And so we have used our local pastors, faith leaders, but also even some local activists and musicians. And these are people that people also connect to and consider to kind of be staples in the community. And so there is a campaign called, and this is Lexington, okay, that's the city I'm in, Lex Do This. Yes, I'm telling you, and it has a catch to it. And what it is using several pastors. They're in there, and it says, Lex Do This for Sundays, to get back into the church. And and it's pretty cool. And they're on the TV, they're on the radio, but obviously much more powerful if you can see these individuals, because several of them are pastors. And the one in particular, because I remember him, and he says, let's do this for Sundays, because so many people were still not able to be back in the churches. And that for so many people is their foundation. It's their support system. It's the key cornerstone to their, livelihood. People are looking more to even what's televised and expanding their spiritual diversity portfolio. For me, it has helped me look at the messaging and some of the things on YouTube that other people are sharing around this and getting different worldviews and perspectives on COVID, its impact and spirituality and the importance of that and our journeys. People have been so much more resourceful than I would have imagined. And I think that they're also being more open to listening to different viewpoints on where we are and how we can go forward.
I absolutely love what you did during the holidays to help people to celebrate, but more importantly, to understand the different ways. When you started working with these different faith leaders and discussing the types of celebrations that they have, one theme came across, and it was the celebration of overcoming dark times. What is this series, this Crucial Conversations? What are you working on with this?
Thank you for asking that. So we implemented that series back in June of last year. And we really felt that there needed to be some space set aside for crucial conversations, identifying safe psychological space for uncomfortable topics. And it was after the death of George Floyd. There were so many things going on in the community. So, in thinking of that, I thought we really need to create a platform. I know we can't all be together, but we need to create another way to be together to have these conversations and make people feel safe to have them. So, we've tackled some pretty tough topics in that, and they're typically just for an hour. We have gotten anywhere from 300 to 600 people virtually. And typically we're sharing information and not too much sharing, because we also want to allot time for the viewers to be able to send in questions. And so we've had several topics around health disparities, police brutality, and the one that you talked about, we looked at how we celebrate, because we thought around Christmas, many people celebrate. And I thought, what a great time for us to look at all the different faiths we have within the hospital, approach some individuals and see who would be interested in sharing their story about how they celebrate. And we thought we'd take all the holidays or celebrations from November through January. And so we found team members within the hospital, and we had probably 2 or 3 physicians. We had our chaplains come and talk about Christmas. We talked about Kwanzaa. We had a Jewish individual, a physician. And so we really wanted everyone to kind of have safe space to share their story and how it was important about their celebration, because all of them were mutually important. And even in our differences, we all celebrate overcoming dark times and light and hope, moving beyond challenging times and togetherness.
When I read about that, I just thought, what a really beautiful way to capture diversity and inclusion, and also, like you said, to give people light. And the other part of this crucial conversations that I think you're hitting on some really sensitive and tender conversations that we really need to have right now, end of life care. And when we are at those end of life or grieving or bereavement or existential questions, we frequently turn to our faith leaders, our pastors, our clergy. In this moment when we have just seen so much loss and so much despair, and in a way where we can't grieve together, how are you working with the faith-based communities to get through? I don't know what other word to use. I think we're all struggling.
Right. Yeah, that one has been challenging, and we've had some fairly innovative ways of at least trying to connect people virtually also during end of life and when people are transitioning and really sick, because the biggest challenge there is again not having a super spreader event and people coming in and getting sick. We've allowed our chaplains to help us guide the decision of maybe when we need to bring in someone of a different faith, and if someone wants to have their pastor, the rabbi, or whoever that may be, our chaplains gauge that, because we've still been very limited about the individuals who are coming into the hospital. That's one thing. The other piece that we've been more engaged in on the staff side of things is just even supporting staff, because staff have become that person, right? They've become that family.
They are the
and that
they
support.
are the family proxy. Yeah,
they're the proxy. So the thing is, we have looked at different ways by which to support staff, because it's very exhausting. One of the things that we've pursued is looking at the concept of restorative justice, having restorative justice circles or community circles, because staff need platforms by which to express themselves and build support for their unique experiences that they've had. So we're trying to look at how we, and again, doing all this virtually, Shauna, because again, we cannot have a lot of people together, but we are trying to build community circles and create space and other options for staff to have some means of support, that can be accessed either through the Diversity, Equity, and Inclusion Council, via me, and or through our chaplain. So we're working collaboratively to build a platform that will allow staff to come together, and especially even maybe after we've had or they've experienced many deaths in their respective areas, to just have that conversation about what that felt like and what supports they feel like they need, knowing that they have supports beyond their respective units.
The word I wanted to pick up on that you used was justice, and you were referring to these community councils. So in June of 2020, your mayor, Linda Gorton,
yes,
invited you and several other leaders to form a commission, the Mayor's Commission on Racial Justice and Equity, bringing diverse people together within the community to listen, to discuss, and more importantly, creating empowering solutions to dismantle systemic racism within Fayette County, within your county.
Absolutely.
So that, I don't know that a whole lot of people are doing this. So hats off to your mayor. What did you learn? What did you identify? What innovations are key to addressing these obstacles that your commission has named?
I have to give all the credit to Mayor Gorton for being bold and audacious, that focused on all those areas, Shauna, that we've talked about, those political determinants, those social determinants of health. So there was an economic subcommittee that looked at finances and minority-owned businesses, a neighborhood subcommittee as well that focused on things around green space and things of that nature. There was education and early childhood development committee. There was a healthcare disparity committee. And so this was very exciting because from that, there were probably a total of all of the subcommittees, 55 recommendations. And what she has done, which I really think this is great, she has a point person that will be kind of overseeing the ebbs and flows of implementing those 55 recommendations. Now, when you look specifically at the one I was able to co-chair, the Health Disparities Subcommittee, some of the things that we focused on was around transportation, because we know that's a huge inhibitor to people being able to get to health appointments. What can we do to partner with LexTran, which is our city bus system, and Meals on Wheels, and some of the other things that are out there to help people get from point A to B, to maybe develop some type of service around health transportation. The other thing that we focused heavily on, and this is really key, is health community workers, because again, you're looking at that cultural congruence and that person that is knowledgeable and trusted within the community. And so we are really trying to look at how can we make that concept and those roles more widespread, and how can places like even UK Healthcare be a key sponsor in subsidizing some of those roles or creating them within our own system even to help with patient navigation in the community, but also into the health system.
One of the things that we have seen as far as access, particularly during COVID, and you've mentioned a couple of times how everything in your health system has had to be virtual. By being virtual, that means you have to have access to the internet. You have to be able to afford it. You have to have a device. These are things that create inequities and disparities. What partnerships are you developing? How are you solving it? Innovations going forward to really think about making sure that digital access isn't another area where we're accelerating inequities and disparities.
I do know that locally in our governor, and I think this is really great, that they're doing some assessments for hotspots and connectivity. And so that is essential, and we should be pushing hard because of telehealth. Now, surprisingly, I think we need to continue to look at the statistics on that. I mean, the uptake of that has been surprisingly well when you look at that, and actually compliance and people's ability to get to appointments has been improved. While maybe you created some newer challenges for people, you've also eliminated some past barriers. And I think that what that has shown us is moving forward, it might be a more sustainable option for folks beyond COVID.
You've come up with some innovations to really help us improve access. Have you got thoughts on how to scale that? I mean, should everybody be reaching out to their faith communities?
Well, everybody should be reaching out to the community. And I'm biased, but I believe that the faith leaders are really a good starting point because it only grows from there. The partnerships have to be expansive and inclusive because when you look at some of the obstacles and the systemic challenges that we have, it's multi-pronged, it's multidimensional. And so your solution can't lie in a single source or a single source of individuals. But I think the faith leaders are a good starting point because they connect you to other people who are the people we serve in the community. When you're looking at taking some of these barriers down and dismantling them, Shauna, it's important to also look at your political contacts. I mean, next week I have a meeting to meet with one of the councilmen here in the Lexington area because he's very interested in some of the work that I've been doing, and I'm very interested in some of the barriers he can help me break through. We have to be strategic and deliberate in the partnerships we build, and everybody's important. And you start with the people who also can be a megaphone and who are safe and viewed as safe and who kind of take you to the next sector of individuals you serve. So I think faith leaders are a good starting point because it's not just in Lexington that people trust their pastors. It's across the nation.
So pastors and politicians.
I do. Isn't that a funny combination?
I was just going to say, it sounds like there's a joke coming here. A nurse, a pastor, and a politician walk into a temple.
But you know, with that, Shauna, too, I mean, yes, it may sound funny, but we want to work with people to escalate the cause, work that they can join you in and help you be more successful. Because there will be perspectives and lenses that local congressmen or councilmen will be able to break through and understand better than I'm going to. And then I'm going to be that expert with the health system and our reach and where we have options to expand services that we have. We should all be working as a collective voice, moving in the same direction. And everybody has different areas of influence based on their skill sets and based on their knowledge of how things operate and run. We should be partnering and uniting very broadly.
So innovation, you've got an interesting platform to innovate from. And oftentimes when we think about innovation, we don't talk about it in terms of making sure that innovation is inclusive, that one of the goals of innovation should definitely make sure that we're improving equity, removing disparities. What are your thoughts about innovation and how are you going to use your role to drive it?
The sky is the limit. And when you're thinking about inclusion, think about people that you haven't thought about before. Think about healthcare in a way that it isn't just within the walls and the confines of where we practice, but how else do you expand access and partner with people who are doing some things a little differently than what you do? Another fabulous partner and a way to be innovative is to look at institutions that are doing place-based services. Well, what does that look like when you connect with a partner like that in the community and provide some services in unique locations? What COVID has caused us to do is change a lot, and some of it very quickly, and we should continue on that path, looking at how can we do things differently and not go back to normal, because normal hasn't been good for everybody, and it hasn't also been inclusive of everybody. Our path forward is very much contingent, and our success is contingent on how we engage the community. We've only touched the tip of the iceberg in innovation. There are people who need to be brought to the table also that haven't had a seat, because representation, as you know, does matter. It is my goal to continually look for opportunities to make the environment better for people from all backgrounds who are doing the work, so that they can be their very best true selves to provide culturally congruent care to the people that we serve every day. I do not believe you can have quality without equity and care. It's all about an inside-out approach where we fix us first, and then we will definitely be making things happen for the people that we serve. Because if we can't fix us first in terms of how we communicate and relate and accept one another, it's going to be more challenging to do that when we're caring for people from all backgrounds.
Nurse Tukea Talbert is Chief Diversity Officer at UK Healthcare in Lexington, Kentucky. In her role, she's been overseeing diversity and inclusion initiatives for the clinical health system, and leading by example, she is remarkably active in the community, finding partnerships in the most unlikely of places. Tukea served on the Mayor's Commission on Racial Justice and Equality, where she was Vice Chair of the Healthcare Disparities Subcommittee. She also serves on the boards of Women Leading Kentucky and Nathaniel Mission. And at UK Health, she's established the Crucial Conversations series as a safe space for her community to share, process, and thrive. And she leads the outreach to faith-based organizations in an effort to listen, to learn, to build trust, and to deliver the care needed in the right places, in the right moments, and in the right ways. As Chief Diversity Officer, Tukea oversees building an inclusive organizational culture that embraces, looks, and behaves like the community UK Healthcare serves. Her work is broad, and it connects health equity, determinants of health, patient experience, student curriculum, talent recruitment, psychological safety, gender issues, and succession planning. It's diverse, and it is inclusive. As cited often in public and population health research, faith communities and religion are social determinants of health. Research shows religious practices, prayer, meditation, singing, and participation, attending services and ministering to others, have an impact across a wide range of health status, behavior, and outcomes. Clergy and faith-based organizations are pivotal players in their communities. They are the public face of their communities, and they provide leadership and connection and compassion and communication, distribution of services, and a capacity for service to others. Many health systems and public health departments have identified the faith community as an important partner in health promotion and are actively working with churches and mosques and synagogues and temples to eliminate health disparities. And as Tukea points out, these efforts and partnerships must be expansive and inclusive because the obstacles and the systemic challenges are multi-pronged and multidimensional. Clergy and faith-based organizations are vital leaders in health initiatives and innovations that engage congregations, institutions, industry, and yes, despite America's commitment to a separation of church and state, engage politicians. These social and trust-based assets are of special value in all communities, but particularly to those who live on the margins, the communities of color, of poverty, and ones where social and economic resources are in short supply. They are the communities that are hardest to reach and hardly reached. And they are also incredible drivers of innovation. It's when we confront and center on those hardest hit by a problem, we have an innovation that works for the vast majority of those facing the challenge. It's innovation guided, perhaps, by divine inspiration and intervention. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.